everyone. Thanks for joining us. I'm Nicole. This is my good colleague, Kelly, and welcome to Tattoos and Telehealth. If you haven't seen us before, we're happy to have you. We really just talk about a lot of patient education we do and some personal stuff as well. You know, we are human too. And so there's a lot of things that we want you as the patient to know, things that are just good to know because maybe you don't have a provider, maybe your primary care doesn't have the time that Kelly and I have to explain things in more detail. And it's nobody's fault. It's just kind of the way medicine has gone. So Kelly and I are dedicated to making sure that we spend the time with you that we need. And if it's short and sweet, then that's fine too. Anything that we talk about today, it is not considered medical advice, and this video does not constitute a patient-provider relationship. Our lawyers make us say that. So today we want to talk about mental health, and thank God that mental health is got less of a stigma than when we started medicine. I mean, it's better, and so that's super, super good because there truly is help out there for patients. And so for me, Kelly and I both have two separate practices, but for me, at HamiltonTelehealth.com, www.HamiltonTelehealth.com, I will treat basic anxiety, depression, things like that. I will do kind of like the bread and butter, just the basic stuff. But my colleague Kelly here, she does a lot of things and digs deeper and handles things on a much, much higher level. So I wanted to talk to her about that today so that she can let us know what she does and how she may be able to help you, a loved one, or, anyone.
For sure. I think that it's incredibly important first to just acknowledge that mental health has really come a long way in medicine. Like Nicole said, it has made leaps and bounds just in the last 5 years, being able to recognize that it is a diagnosis. It is a disorder. It is a disease. It is something that exists in people, and it should be recognized and it should be talked about. It should be presented as something that we can discuss openly and without criticism or without concern of being made to feel like there's something wrong with us. I think if you guys have been following us, you've heard us both talk about how we got into telemedicine. And for me, mental health was a big reason why I walked away from brick and mortar, why I walked away from the hospital. And so there was no option for me not to provide that type of care for patients and not give them a safe space. And so that's the blessing of telehealth is this is my safe space here at home. That's Nicole's safe space there in her home. And the great thing about mental health is even if you just need the basic bread and butter, anxiety, depression, Nicole can take care of that for you from the comfort of whatever space you guys consider as safe. If that's in your car, please pull over. If that's in your car, if that's at the picnic table outside of work on your lunch break, if that's picking up the kids in the school line, whatever, that's your safe space. And wow, Nicole, what a blessing. Like, don't you feel like patients think that is so much easier for them as opposed to walking into a therapist's office or walking into a psychiatrist's office where who knows who can see them?
Yeah, I mean, I definitely do. I think that especially post COVID, but in general, your home is your safe space. And if you can express yourself and be vulnerable, there's no better place than to do it than in your home. And sure, you can go to an office if you need the privacy, if you have a large family and it's hard to get away. Certainly there's reasons and it's absolutely okay. There's no right or wrong. However, telehealth has created such a safe space for patients to be located in their safe space while they're getting care. And I think that it's embarrassing for some patients. I wish it wasn't. From my whole heart, I wish it wasn't, because if you have high blood pressure, we're going to treat that. If you have anxiety, we're going to treat that. If you have diabetes, we're going to treat that. So it's just another thing, right? You can't control it. So I think being in your home does allow patients a little bit more of that vulnerability than going into like a sterile office per se.
Yeah, absolutely. It has also allowed us an opportunity to, especially over the last 2 or 3 years, expand on what we can treat via telemedicine. I've been able to go from just providing what you do with bread and butter, anxiety, depression, short-term refills, get that medicine taken care of while you're lapsing, trying to wait for your provider to get you back in, to really expanding that. And I did that because there's an even bigger gap in the availability of providers for patients to
It's
get
huge. It's
that
huge.
second level of care. Like we have a majority of, I would say, the majority of the mental health population sits in that level one, that basic anxiety, depression. We all just need something to help get us through the days. But then there's just that niche market of people that fit into that level two. And they need just a little bit more attention paid to those things. They have a little bit more than basic anxiety and depression. Maybe they have a low level bipolar 2 disorder. Maybe they have depression and a little ADHD. Maybe they have a little OCD. I have OCD. I've talked about that before, how several of us healthcare providers post-COVID developed OCD because it was ingrained in us to wash hands, wash hands, wash hands, put on the mask, take off the mask, wash the hands. Like it was ingrained in us. And so I developed a little bit of OCD after that. And so I think that we now can recognize that there's a pool of patients in that level too that don't have access to care as readily as we would like them to, whether that's because they live in a rural setting, whether that's because they live in a population where they're just missing out on the opportunity to see a provider because their offices are full. And telehealth allows me to be able to fit them in. And I'm now with functional medicine, I can either approach that from a functional standpoint and say, how can we treat this based on your lifestyle, your sleeping habits, your eating habits? Nutrition plays a huge role in how your body feels, how it sleeps, how it reacts, how it processes. There is a large gap in the understanding of how your body reacts to what you feed it. I harp all the time on you are what you eat.
Garbage
And
in,
that,
garbage out.
yes, that could
Yeah.
not be further from the truth. You feed it garbage, you feel like garbage, you let go of garbage. Like it's just the way it is. So from a functional standpoint, I can go into an hour and a half spiel with patients covering head to toe, and we make little changes at a time, and I see you back month to month, and one little change at a time. It's not overwhelming. It's not more than you can handle, but month to month, we're going to make little changes. And within 6 months, 3 months, I have patients feeling so much better. So
I
we have
like
a
that you
function.
hold them accountable.
Yes.
I
And
like that. I like that you hold them accountable. I will meet you next month. This, if you need me before then, you let me know. Like, I love that you do that. And this is no blaming on any one provider or any one group of providers. It's just medicine in general, right? It's like herding cattle sometimes, right? And we don't want to do that. And that's why we're here, because we don't want to be in that where we're having to herd cattle. You have 15 minutes to see the patient, and that's including everything, but I really like that in this setting, you can hold the patient accountable. And when patients feel that they haven't otherwise been heard, again, no blame, but there are situations all the time where patients don't feel like they're being heard and they're being brushed off or they're being rushed out. And in this situation, telehealth has promoted you to really take the time to be able to, if you need 15 minutes with the patient, if you need 20 minutes, if you need an hour, if you need whatever you need, we can provide that. And Kelly really digs in. And sometimes that's just what the patients need. Sometimes it goes way back. We carry things with us, traumas and things like that. And I know that you are very, very dedicated to really getting down to the root, because if we have a weak foundation just as humans in our life, it's hard to build on that and move forward from that. It's truly hard to build on a sinkhole if something underlying isn't resolved. And I know when you first told me that you spent really a long time digging in, I was just super, super impressed, because some patients, not everyone, but some patients just truly, truly need that.
well, there's a lot to be said for the realization that your body is a truly amazing entity. It can heal itself. It needs our help, but I think it needs our help from the standpoint of, one, education to the patient so they can learn their bodies. Two, it may need our help from understanding that there may be a disease process going on underlying everything. So once we kind of, clear up the muck, so to speak, sweep out the attic, get everything kind of organized, then we can start to see, okay, we swept everything, we packaged everything, we wiped everything down, but this is still broken. That picture frame is still shattered. We still need to work on that. And so as we do that, things become visible to us. Then we can start to really see this really is broken. Now we can work on fixing this. But we don't have all the muck in the background making us try to figure out what's happening because we cleaned it up. And so I try to present that in a way to patients where they understand. And at the end of the day, they've learned their bodies so well that they can heal themselves easier in moments of stress, in moments of anxiety. And a lot of patients are fascinated to know that there are over-the-counter and supplemental, medications that they can take to help ease that anxiety. That's not prescription, that's not addictive, it's not a controlled substance, it's not those things that they're trying to get away from. Maybe nobody told them that, nobody told them there's an alternative to those things. And I have patients that are very shocked to hear that. I had specifically a lady tell me yesterday, we spent a good 45 minutes together just talking about supplements, and she said, wow, Kelly, you've taught me more in these 45 minutes than in the last 5 years of me with my psychologist. And that blew me away. That should never be this.
Wow.
That should never
Wow.
be shared, ever.
Ever. Wow.
45 minutes in a consultation, an initial new patient consultation, should never have provided her with more information than she learned from a professional in 5 years. I'm happy that I can do that for people. And I think it's fantastic that in this telemedicine space, we have the opportunity to do that.
It's also
Yeah.
sad.
Yeah. But I hope that I am blessed to continue to be able to provide that to patients. So in that level two, when we exceed functional medicine and we step into the role of prescription medications, then I can move on up and start to talk to them about their bipolar disorder, their ADHD, and help to supplement those medications as well. So yeah, I have expanded a lot of my practice to be able to take care of that. And I think as providers, one of the most important things we can do is humble ourselves and know where our limits are. So I also know when it's time to say, you've exceeded my limitations and it's time for me to refer you. But the great thing is we can do referrals too. So we can
Yeah,
always
I
help.
refer to you a lot. I do. I refer to you when it's something really out of my wheelhouse. I mean, I'm super comfortable with anxiety and depression, super comfortable. But beyond that, it's just not like, nobody can do everything 100%. And that's just not my specialty per se. So I probably refer a couple to you a week just because I know that you can take that time to dig in and you have that knowledge. I mean, you went back to school to do functional medicine. I'm going back to school for healthcare law. So it's two very different kind of like specialties where we're digging into. But yeah, I refer to you, and it's because I know that you'll take care of them and definitely have the knowledge to do so.
I think we're incredibly blessed in this space to be able to provide that care.
Yeah, I think so too.
And, part of the blessing of telemedicine and being able to see patients in this aspect is we can still provide these services for our patients. So guys, if you come in and you see myself or you see Nicole and we can't handle it, we can still refer you out. We can help you, navigate. If you have insurance, we can help you navigate that and figure out where there's covered providers in your area. We have people that can help you do that. We can write the referral for you. So don't feel like, this is a space that is unlike any other, that you can't have those services. So if you come to us and we say, this is kind of outside our wheelhouse, you're not stuck. We're not going to leave you floating, dangling, flapping in the water. We're going to help you out. We can still make those referrals for you. So please, guys, don't think that you are stuck. We will absolutely still help you. That is, at the end of the day, our number one priority is still getting you to someone who can take care of you, even if that's not us. And I know Nicole feels the same way. I am the first to say, you know what? I don't know, but let me find out.
Yeah.
I don't know, but let me find someone who does. I am not ashamed to say those things.
Yeah, for sure. For sure. Yeah. And I would say 90 to 95% of everything we can handle.
Yeah.
But every once in a while, just don't, maybe something outside or a specific specialty that we just don't. That's totally okay. But, you won't know unless you look us up and try. So,
Right.
well, thank you for joining us today, everyone. You can find me at www.hamiltontelehealth.com. And you can find Kelly
at www.charihealth.com. That's CHARI.com.
And you can follow us on Facebook and on TikTok or whatever social media platform you have. You can follow us. And we hope you guys have a wonderful week. We'll see you next time.
Bye.